Hello and welcome to today's ALS Symposium. My name is Ginny Demers, and I'm the main caregiver for my husband Roger, who was diagnosed with ALS in October of 2015. Knowing how emotions can roller coaster during a loved one's journey, whether it be that you are the patient, a family member, or a caregiver, it is important to learn that what avenues are available to you to help you get through the day. Grace Plummer is a licensed clinical social worker practicing on the outpatient neurology team at Midcoast in Brunswick, Maine. Her work over the past 5 years has been about supporting people with chronic illness to find a way to cope better, both by assessing their own inner strengths and by learning and using evidence-based tools. Grace first became interested in integrating mindfulness-based therapies into her clinical practice in 2010. After facing some personal challenges that required a new kind of coping. After many years of focus on mind and body healing through meditation and yoga, Grace chose to attend a 2019 mind-body medicine program through Harvard Medical School with neurologist Dr. John Taylor. This training reinforced the need to focus more on using this integrative strategy in current clinical practice, which has continued to motivate and inspire Grace. Grace has additional training in somatic experiential therapy, mindfulness-based behavior therapy, and insight meditation. In her free time, Grace is using mindfulness and a large box of coping skills to raise 3.5-year-old twin girls. Therefore, it's with great pleasure that I now introduce you to Grace Plummer. Welcome, Grace.
Thank you so much, Ginny. It's a pleasure to be here, really an honor to be invited here today. So hello, everyone. I can't see you, but I trust that you can see me and my slides here. And as you see over in the chat box, Amber is encouraging questions. I'm happy to facilitate any questions in our time today. So we'll also have a formal Q&A time at the end. So let's get started. So what are we going to talk about today? We're going to answer the question, how do emotions behave? So what is the nature of emotion? We are going to talk about why emotions are important. We're going to talk about what some common emotions are in serious illness. We'll talk about how we can increase positive emotions. We'll discuss some strategies for reducing susceptibility to negative emotions. We'll look at some tools for management. And then we'll talk a little bit, because I am a clinician, about what is sort of in the normal or typical range, and then what may be moving more into a place of needing some support professionally. And we'll do all of this in 40 minutes. Let's see. All right, so this is Marsha Linehan. She's an American psychologist and author who created Dialectical behavior therapy, which is a model of therapy that integrates behavior therapy with compassion and mindfulness. And so here I have, a really basic sort of, perhaps even common sense, but she says all people are prone to emotional reactivity when they are under physical or environmental stress. So I share this just to normalize that, by very nature, we are sensing, perceiving, behaving, thinking, but also feeling beings. We very intelligently have a system for feeling emotions that allows us to interact and move about our environments and our relationships. So how do emotions behave? Emotions are fleeting, they're temporary, much like weather. It doesn't always feel that way. However, we do know if we pause and take notice that often, people will describe, I had a bad day, or I had a difficult morning, or I've had a really emotional day. And then, of course, their experience the next day is different. The fact that emotions are fleeting is a helpful realization also when we're in a place of experiencing really intense emotions. So we move in and out of them, of course. They can be intense and difficult. So though emotions are uncomfortable, they're not dangerous by their very nature. So in their purest form, emotions aren't dangerous. We humans have an incredible ability to, in mind, body, and spirit, to experience a full range of emotion. In fact, the body and the mind want that. So it's really only when we add these secondary emotions to primary emotions, which we'll talk a little bit about briefly, that creates such complication for us. So Laura Lipsky, she writes a book called Trauma Stewardship, talks a lot about the human capacity for not only tolerating and managing intense emotions, but also integrating them into who we are in a way that is adaptive. So Laura Lipsky, Lipsky, if you're interested in reading more about that. But of course, lastly, emotions can trap or hijack our ability to think straight. I can't tell you how many people I see in practice who say, I just sort of learned from watching mom and dad be overreactive, or I learned that my emotions, weren't helpful to me as a young person. So I've just sort of learned how to live outside of my emotional experience because I want to be productive, or I want to be successful, or I want to be able to stay cognitively present. And we'll talk about what the consequences are to trying to, suppress or not care for our emotional self. This is one of my twin daughters about 3 years ago. You can see she's feeling lots of emotions there. I love this picture. I had to share it. So why are emotions important? They're informative. They give us information about what's going on in our world. They give us information about what's important to us. They may signal us that something is happening. They may alarm us that something is happening. Again, they organize and motivate our behavior, the actions we choose, and those of the people around us. They communicate to other people. They influence us. And strong emotions can help us to overcome obstacles also, often by motivating certain behavior. So let's get a little bit more specific. So what are some common feelings or emotions in serious illness? Guilt, anger, frustration, gratitude, sadness, confusion, loneliness, love, fear, shame. I invite you in this moment. I don't want to forget any. Of course, just if anyone is interested and willing to add something, in the chat box. What else comes up for people? Whether you're someone with ALS, whether you're a caregiver to someone with ALS, whether you've experienced serious illness yourself or not. We've all loved and cared about someone with serious illness. What are some emotions that people might feel that are not listed there? Helplessness. Yes. Yep. Yeah, helplessness, hopelessness, embarrassment. People describe, feeling, anxious, which of course, thank you. Yeah, someone's writing anxiety. That's, essentially how fear manifests in the body is as anxiety. All very common. And you'll see too that I didn't want to leave out some of the positive emotions. Someone's writing in loss of control. Yeah, absolutely. A sense of selfishness. Woe is me, as though no one else has problems. Good. Feeling overwhelmed. Yes. Yes. Perhaps at the beginning of given a new diagnosis, or moving through multiple medical interventions, choices are being offered. Your family's trying to, grapple with the diagnosis and what it means. Incredibly overwhelming. So as I was saying, and please keep adding. This is the reason we're meeting today. I want to hear from you guys. I appreciate it. But I do add love. I add gratitude. People often report a stronger connection or closeness with themselves, with their family and friends. I think that's an important part, a thankfulness, a gratitude for their life and the people in it. And those emotions can be intense, as intense as fear, especially if someone's experiencing that level of gratitude or thankfulness in a way that perhaps they haven't before in their life. Sometimes also we people experience resentment. Some people describe rage. There's really, of course, a whole broad of emotions. And I tell people every emotion is normal to have. We'll talk about when does it get to a point where it may require some intervention, but there's nothing that's off the table. So here we go. We're going to talk a little bit about Laura Lipsky's work again. But so, of course, the goal is how do I increase my experience of positive emotions? Many people will say, I don't want to be sad. I don't want to be angry. And of course we don't, because it's uncomfortable. However, one of the things we know from extensive research in neuroscience, in trauma integration work, is that we can't selectively blunt emotions. Human beings can't say, well, I'm going to turn off sadness and anger and expect to feel joy and pleasure. What happens is when we turn down or numb or dull out, we dull and numb out everything. We blunt joy, we blunt happiness. And so, in Lipsky's work, she talks about how seductive it is to numb out. And we know this, if you look at, of course, what's happening culturally, what's happening globally, even if we extend a tiny bit beyond ALS, it's really seductive to consider just kind of turning off. But unfortunately, that has a toll, sort of a long-term toll, an insidious toll on us. Often it's major depression. So because we can't choose what we numb out to, I do encourage people to lean into all of the emotions, because the benefit to that is that you get to experience positive emotions. And as I said, we do have capacity to hold both pain and beauty, or sadness and joy at the same time. It's a duality that human beings are incredibly capable of if we feel safe, and if we can do it with good love and support. And we'll talk more about that today and in the afternoon session on mindfulness too. So practically though, what can we do? So doing pleasant things that are possible now. What is it in this day that might be pleasant for me? Reviewing an old photo album, listening to my favorite song. What is something that's pleasurable to my senses, right? Maybe we can't eat food anymore. So what is it that I can listen to that really elicits pleasure in me? Attending to relationships. This is enormous. Of course, you all know this in the setting of serious illness, is that, repair old hurts, give attention to, attending to those hurts. There's a fabulous book by Ira Byock. He's an MD. He's a leader in palliative medicine who, I don't know if he's still at Dartmouth, but he writes a book called The Four Things That Matter Most. Again, it's Byock, Byock. And so the four things that matter most: I love you, I forgive you, please forgive me, and I'm sorry. So again, attending to relationships is a way to, though maybe difficult, it can elicit a more positive emotional experience for us, especially if we're holding on to something that needs some attention. Avoid avoiding. So we know that what we resist persists. It's this idea, of course, is in therapy we call it approaching versus avoiding. What do I need to approach today versus avoid that may be difficult, but that will again generate either feelings of satisfaction, of mastery, of closeness with someone, of joy. So being mindful of positive experiences. I'm sorry, it's not I'm sorry, it's thank you is the fourth one. Forgive me, that Dr. Byock writes about. So be mindful of positive experiences. It means being present for what is, noticing, the blue jay that's outside your window, really kind of basic things that, if we're present for them, they, again, neuroscience shows they stimulate pleasure centers of the brain, which have enormous benefits, which I'll talk about in the afternoon session when we talk about mindfulness. And then some of this comes from Marsha Linehan's work, the DBT psychologist I spoke of earlier, but she talks about being unmindful of worries, meaning not giving them a ton of attention. Worries tend to be something that is rooted in fear and that is based on a future event that will 99% of the time never happen, or never happen in the negative kind of a nihilistic way that our anxious brain might think it will. And do something that makes you feel a sense of mastery. Again, we're talking today in the context of ALS, so I'm not suggesting that we, build another home or, run a marathon. The sense of mastery can be, reading a story to a grandbaby, or I know, again, we're in this pandemic, but when people hear the word mastery, they think of something enormous, and I encourage you to think of small things. I'm working with someone right now who's putting together a photo album and working with her partner to just pull out all the old family pictures and put an album together. And it's I think the first time in maybe 7 or 8 months where this person has been feeling a sense of pleasure. And I write, and ... consider vulnerability. So in our culture, we think of vulnerability as being about weakness. We think of vulnerability often as being about loss of control, as someone thoughtfully put in the comments. But instead, I encourage you to think about it as an openness or a willingness to be with whatever is happening. Again, knowing that you are absolutely capable of tolerating pain, sadness, grief, loss. You can tolerate that. And by being courageous and vulnerable, which might mean calling an adult child you haven't talked to in 10 years and saying, I'm sorry, that, we know that this often generates incredible satisfaction, connection, which improves people's experience of quality of life and sense of connectedness. So Brené Brown, I'm sure some of you in the audience have heard of her. She just recently interviewed one of our presidential candidates. But she's a shame and vulnerability researcher. She's a social worker also, like me. But she says daring greatly means having the courage to be vulnerable. It means to show up and be seen, to ask for what you need, to talk about how you're feeling, and to have the hard conversations. She writes a book. Brené Brown actually works with Fortune 500 companies. She works with leadership, but she also has a clinical practice. And she writes a book called Daring Greatly that I highly recommend. And she talks about kind of systemically and culturally post 9/11, how there's this sort of hum of fear that we all have if we're not mindful of it, and that the way to move through that or be with that, or try to quell that a bit, is by being vulnerable. Being vulnerable means, helping someone who maybe looks unfamiliar or elicits biases in your mind, helping them, I don't know, get their grocery cart out, something like that. Vulnerability also can mean, rolling over to snuggle a partner who you haven't touched in a long, long time. Vulnerability can mean, I love you. I'm scared that you have ALS. I'm scared I don't know how to care for you, but I want to, and I'm going to need help. That's vulnerability. I think we all know what vulnerability is. If you've felt it before, you kind of come out of it feeling really raw, a little shaky. And then when that subsides, most people feel pretty good after we've had a good cry, perhaps. All right, being mindful of the time. So how do we reduce our susceptibility to negative emotions? So the bad news first, we will not experience negative emotions if we're open and we're paying attention. Again, normal part of being human. People will come in and see me and say, I'm crying a lot, and gosh, I'm sorry. They'll apologize to me. I'm sorry, I'm so tearful. And of course, I have a certain level of comfort being in my practice for the past 13 years. But what I say to the person is, well, of course you are. This is sad. I would be more concerned if you weren't having this emotional reaction, because that would tell me you're not paying attention, or that you're not awake to what's going on. Doesn't mean we need to live in that sadness day after day, but having fleeting periods of difficult emotions, of course, is normal. And again, I already said it, what we resist persists. So meaning that giving a bit of attention, which I'll talk about later also, giving attention to an emotion is a down regulator. So just by virtue of saying, I feel really sad, or I'm in a grumpy mood today, is enough to dial the intensity of that emotion back a bit. So little benefit without even doing anything, just giving it attention. So how do we reduce our vulnerability or susceptibility to intense negative emotion? Well, consider realistic expectations, right? If you're going into ALS expecting to, be strong for your family, being a warrior, you will do that. You will be strong. You will be a warrior. However, you may have low points, and going into this journey with that expectation allows people to move more kind of fluidly through it, at least from my observation. And of course, you're welcome to disagree, but I do think that realistic expectations are helpful. Let's see, what else? Consider giving attention to what is, as I said, just giving attention turns the dial down. And then consider the idea of psychological flexibility, which we talk about in therapy. It's just this idea of openness that, many of our beliefs or ideas about life might be challenged when we get a diagnosis of ALS or a serious illness. And so, giving yourself, your partner, your family permission to be flexible, to have an openness in how we think about things. Many people will come in saying, I want every intervention. I need to, live as long as possible, and then change their mind, or they come in opposite. I don't want a peg tube. I really want to do this naturally. And then, with time, they change their mind. So allowing for that's a really concrete example, of course, but just allowing flexibility and fluidity in your thinking can be a helpful way to reduce propensity for negative emotions. So in the previous slide, you see I said the bad news is that if we're paying attention and we're open, we will experience some negative emotions. But the good news is that we can reduce how susceptible we are to the intense, constant, overwhelming negative emotions that may actually develop into something more, clinical, something that would require intervention. And so how do we do that? We have realistic expectations of ourselves, taking care of our body, taking care, of course, of the, the symptoms, managing symptoms, but taking care of your body in a larger way, asking for someone to lotion your feet, making sure, your ears are clean, whatever it is that allows you to feel comforted. Avoiding excessive use of alcohol and drugs. We know that this, excessive use can both turn the dial down on our ability to feel just in general, and that it also compromises all of those good neurotransmitters that are working hard to try to experience pleasure. Prioritizing good sleep. If you've worked with me before, 100% of the time I ask about sleep. We will be challenged to be emotionally regulated if we are, of course, sleep becomes impaired as our body is uncomfortable, as we're dealing with things like excessive, saliva and pain and, spasms and things like that. However, I encourage you, if there's something that is supportive, such as accessing a hospital bed or using, lorazepam to help you settle at night, getting good sleep is just imperative. Approaching versus avoiding, we already talked about that. Engaging in pleasant events. I will say, too, for those of you who are feeling, whether it's related to being, in a wheelchair now, full, all of the time, whether it's about the pandemic, that we know through functional MRIs now that even recalling a past pleasant experience, let me say that again, even recalling a past pleasant experience, meaning laying down, maybe laying with your partner or not, closing your eyes, remembering that time you did hold your grandbaby, remembering the time that you held your baby, remembering a trip that you went on, remembering what it's like to walk on the beach, feel the breeze, that stimulates the pleasure center of the brain as if you're really experiencing it. And it generates all those good chemicals and hormones in your body. So something to think about for those of you who are feeling like, Grace, what pleasant events are there? Just giving yourself time to reminisce. Photo albums are great for that too. And then identifying comfort objects, we call them, comfort items, and using those comforts, giving yourself permission to use your comforts, whether you're a person with ALS or a caregiver. A comfort could be the voice of your parent, a cup of tea, your favorite blanket. Think about the way you would comfort a child. And I'm not intending to, infantilize anybody. It's more, think about the comforts you would offer to someone. And it's not about, it doesn't have to be about being sick. It's that, we just by virtue of being, thinking, feeling, perceiving, intuiting beings require comfort. And so I just encourage you. In fact, for many people right now, I'm doing some work on creating winter comfort plans, knowing what's ahead of us, winter survival plans, call it what you want. But just how might I find comfort in these next couple of months, perhaps the next 6 months, And what are the things, on my list? Your favorite poem, being bathed, the warmth of the shower, a heating pad, but I do encourage all of you to make a list. So then briefly, let me see where we're at here. Okay, we're doing just fine. So some tools for managing difficult emotions in the moment. Breathing, number one strategy that we have in our back pocket all the time. And I'm not saying deep diaphragmatic breathing. I know that respiratory compromise is part of ALS. I'm saying just breathing naturally as you are is something you can do to take pause, to generate a little bit of space between the stressor and your response. Movement. So for many of us who, have been runners or yoga practitioners, or, there's a tendency to think of movement as, in fact, in previous literature and research, that would have said exercise, but now we're calling it movement, which means we know that even wiggling your body can close a stress cycle. There's a book about this. I'll have to think of it, but it talks about closing the stress cycle using movement or a breath, which allows the body to experience the full range and then get rid of what you're carrying in your body. So just basic movement, if you can, is a tool. Talking, of course, that's externalization, letting out what's inside. You can externalize emotions by writing about them. Many of you are very creative. I've learned, so inspired by the creativity of people who I meet with. Art, writing, creating is a way to externalize emotions. Being with the emotion, knowing it's not dangerous. The emotion itself is not going to take your life. In fact, you're more at risk if you don't let yourself feel it. And that's, we'll talk about that in the next session later. So mindfulness is being with. Prayer, for many people, is a helpful tool. And then moving into more what we talk about in therapy, kind of some cognitive skills. So what am I talking, what's my inner dialogue? What am I saying to myself that might be helpful or unhelpful? And there's a whole model that we use in therapy to go through that, which includes thought appraisal, appraising your thoughts. Are these helpful thoughts? Where are they coming from? Are they useful? We work through those and try to shift things a little bit. Okay. So this is Seneca, the Roman philosopher. He says, we suffer more often in imagination than in our reality. Again, all those fear-based thoughts we have that can consume us at 2 o'clock in the morning. Often they never happen. All right, so let's spend just a minute before we talk about resources and I take some questions. What is normal emotional expression and what may require some attention from a therapist? So crying, again, very normal, healthy. Just so you guys know, crying on average lasts about 5 minutes. So if you take, I don't know how they do this research, but it's helpful to know. People will say, I feel like if I start crying, I will never stop. That's incredibly unlikely to happen. You may cry all day, off and on, of course, but crying is not concerning. Uncontrollable tearfulness that's daily, that you feel, again, turns on in inappropriate times. And I'm not talking about pseudobulbar affect. That's sort of a different etiology. That's part of the disease. But if you're consistently feeling like your mood is poor, you're trapped in this constant tearfulness, that's concerning. Short temper. So we know from many men in our culture that irritability is a form of emotional expression that men tend to express, women alike, but more so in men. Normal, as long as it's fleeting. If it persists or it becomes displayed as aggression, I have a person I'm seeing right now who came in to see his neurologist and was referred to me because he said, I'm throwing things across the room. I feel like I'm raging. And I used to be an irritable guy, but now it's just feeling out of control. And he has a new Parkinson's diagnosis. So, keeping an eye on that. Periods of feeling sad, normal, as we talked about. However, constant sadness without any moments of joy or pleasure is a concern for depression, of course. So people who are grieving, this is one of the ways that we differentiate grief from depression. And you'll hear me say this if you've worked with me and we've together ruled out depression, is that people who are grieving can be sad, tearful, feel a sense of loss. They might withdraw sometimes. But then when their family's around, they're engaged, they might be laughing. There's a sense of pleasure. They feel a sense of purpose when they're connected with others. So again, if you're not experiencing any of that, then that might be a sign that you're dealing with some depression. We do know that about 30% of people with ALS, some studies have said 40%, will deal with a mild depression that can require some clinical attention from someone like me or your primary care doctor. Fewer, I think it's like 15 to 20% of people with ALS will experience major depression, meaning, you're meeting criteria for moderate to severe level of depression symptoms, which at that point, we want to use medication often and definitely would encourage some therapy for you. So needing time alone, normal. With complete withdrawal is concerning, of course, if someone withdraws entirely. Feeling lots of different emotions, normal. Feeling stuck in one, again, might require some attention. I can't get past being angry, or I just feel so lonely and I'm stuck here. Might be helpful to just, see somebody. And then thinking and talking about death, hugely normal. Unfortunately, we're in a death-denying society, which means that so often I will sit with families and, you hear an adult child say to their parent who has a terminal illness, "Oh, don't talk like that, Mom. Don't talk like that." That's cultural. That's not about that person's, maybe it's partially about that person's disinterest, but or fear or sadness. But talking about death, normal. I encourage it. Let's not let it be as scary as the culture has made it for us. But if you're thinking about suicide, that's a little bit different. Active thoughts of actively ending your own life, then you might want to bring that up to your doctor. Different than death with dignity, which is a whole nother conversation. But so let's see. I'm talking a lot, rushing through. Just some quick resources before I take a couple questions. Many primary care offices in Maine, specialty care, so have clinicians embedded in the practices. Waldo County, York County, Cumberland County, Saginaw. There are 80 people like me who I know of in my team who are integrated in practices like I am in neurology here in Mid-Coast. Certainly ask your primary care if you're looking for a therapist. If they don't have an integrated clinician, they often have a list of therapists locally who could be supportive. Most therapists are offering Zoom visits too. People who are employed, so perhaps that's the person with ALS, perhaps that's the caregiver. Many employers have an employee assistance program where you can get counseling free for a certain amount of sessions. And then just Psychology Today is a fantastic database. You can go in and look for a clinician that way. And then I always put in the statewide 24/7 helpline, which is for, crisis, pre-suicidal behavior, but suicidal thinking. Again, just a helpful tool. So I hope I've answered some of the questions that perhaps you hoped to have answered, when you joined today, but please feel free to, I see Lori logging in, feel free to ask any. I'll give some time for people to type or speak to text.
Perfect, Grace, thank you. Again, folks, use the chat space or the question and answer. It looks like Ginny has some comments. That was wonderful, right on point. The information provided helped us, and hope everyone else found it very helpful also. So thanks,
Thank
Ginny.
you so much, Ginny.
I wanted to point out again, we're going to give time for other comments and questions, but I wanted to point out something to folks who have watched Grace's presentation and maybe saw Brenda's presentation last week. Brenda did a piece on managing symptoms of ALS, and I wanted to point out how important emotional symptoms are. Grace and Brenda share an office space with Dr. Taylor, a neurologist, and so I think it's really pertinent to point out emotional symptoms need treatment just like your physical symptoms. And it's so important that, at least in our case at Midcoast, Grace is actually there to work with the rest of the team because what she does is equally as important to what our nurses and our neurologists are doing.
Absolutely. I see Ginny's asking, do you suggest mindfulness meditation? Absolutely. Yes. You know, I'll talk about this more at 1 o'clock, but, you know, if mindfulness can be anything besides, you know, what the definition is, of course, which is paying attention, being present with what is without trying to change it, compassionately, that, you know, it's a quiet practice. And so, you know, how are we supposed to move through our life thoughtfully, you know, gently, take care of ourselves and other people, if we can't quiet, you know, the clutter, the intensity of what's going on around us, within us. So whether your quieting practice is breathing, praying, meditating, a really formal, sustainable, you know, mindfulness practice, absolutely, I encourage all of it. Yeah.
And Mark has given a little plug, Grace, for your 1 o'clock presentation. So that folks know, Grace is back with us at 1 o'clock to talk about mindfulness. Dustin remarks, your presentation was very informative. Thanks.
You're welcome.
So we do have another minute or two if folks are still working on their questions or comments. And if we don't get to them, we can certainly address them one-on-one a little later on. So I want to remind folks, we are going to take about a half-hour break. That's a great time, of course, to get lunch, but please visit our supporters in the expo area. Now's a really great time to download any of their brochures. Lots of folks have just helpful things that you can save for a time that it's going to be more pertinent to you. And I'll remind you of Karen's gamification and scooping up more points for prizes. So Grace, we're going to give you about a half hour or so. Nope, you get about 45 minutes. We'll see Grace back here at 1 o'clock, but we'd love to get everybody back at 12:45 to meet another couple who want to share some of their experiences in their ALS journey. So enjoy, and we'll see you back here, folks, in a half an hour.
Thank you.